the entire ruby, diamond, right, gold, pata nahi kya platinum. So where it is existing, we will see that now anterior midline. इतना वक्त हमने temporal region, the anterior oblique of the temporal vertex हमें देख लिया. तो अभी हम देखेंगे the anterior frontal line. इसमें भी कमाल है, छुपा हुआ है. खजाना कहाँ छुपा हुआ है? Mountain, right? Hills, forest, the entire ruby, diamond, right? Gold, पता नहीं क्या क्या, platinum. So where it is existing? In the forest, isn't it? But here is the forest is there. In that forest we try to find out everything, right? Then don't ask me ruby, give me again, right? But you try to find out here, you will find the diamond, gems, everything. Now we are talking about the anterior hairline. Is the amazing line, the cerebrum to be known as the biggest part of the brain, having the numerous physiological functions in the body system. Now we look into that where exactly these points are located. Now just you see that there are the 1, 2, 3, 4 lines are existing. Now I am talking about the international standard nomenclature of the acupuncture. But if we match this, but Yamamoto also coming cross over here, but however I talk later about it. Now the central line to be known as a, which we call as a Shenting and then Intang. Shenting is the DU24 and Intang is the Bindi point or the third eye point. This the entire line is the midline. Entire line to be known as a midline. Now what is the midline of the forehead? The front of the head, 1 chun long, that means the 3 centimeter from the DO24 straight down along the meridian. Remember this is the most important point for the head and neck related disorders. Head and then neck related disorders easily can be treatable by activating the one point that to be known as a. So we just, whenever we wanted to apply here, make sure when you keep applying the spirit on the hairs will become black. Black or white? White, okay. You should teach me sometimes, no? Okay, I don't apply. Then I just apply this as a dry cotton here. By the way, wet cotton is really important. So once you wipe it, this is the entire region. Then you just use the 1 chun needle. Then from DO24, where is the DO24 Shenting point is located? 0.5 chun proximal to the anterior hairline on the midline. You just insert the needle and then further this goes to the downwards direction. So this will be useful to treat for all the head and neck related disorders. All the head and neck related disorders can be treatable if we apply the needle in this direction. So now we understand this region is the anterior midline of the forehead. But however, there is a numerous theories, the Fang acupuncture, Leo acupuncture, then is the Yamamoto acupuncture or the Chioshanpa acupuncture, experimental acupuncture, yin and yang acupuncture, then the meridian acupuncture, the points related acupuncture, tongue mapped acupuncture. All the people will say that, but this is connecting to the head and neck region. This connecting to the head and neck region. But normally what happened for the known and unknown etiology and pathogenesis related to any kind of the problem head and neck, you just apply the needle. This region is always good to treat for the many related disorders, head and then neck related disorders. But micro level you wanted to know, micro level, 1 mm, 1 mm is a very, very micro level, but each and every micro level I'll tell you which part of the pot existing, but now it's not required. Later I will try to tell you, but as of now you keep it in the mind. But this is as a treatable for the head and then neck related disorders. By the way, this is the mental disorders, especially for the children. Even yesterday one child came, 1 year 4 days. 1 year 4 days is the one child came. So for that child, his neck is not erect. So that time you remember that, I think might be have seen somebody else here, but that I applied on the anterior region by keeping in my mind fontanelle I shouldn't damage, right? Fontanelle shouldn't damage, but fontanelle is existing with her. 1.6 year, that means maximum fontanelle when will going to close? 18 months, 12 months to 18 months, majorly 1.5 year, all the fontanelle will going to close. Thymus gland, when it will going to terminate? At the age of, very good, 14 years. At the age of 14 years, thymus gland will get terminate. That means no more function. Likewise, this the fontanelle arc of 1.5 years will going to close everything. But now 1.1 year baby, that she do have the fontanelle. By keeping that intention, I just inserted the needle here for to keep the neck erect position. You understand? So this is one kind of the, especially for the convulsions, epilepsy related disorders can be treatable. Whenever you wanted to treat epilepsy, make sure to try to find out EEG, electroencephalogram is important. So that try to find out where exactly the epileptic forms are forming on the parietal lobe, temporal lobe, occipital lobe, frontal lobe, which part of the waves alpha, beta, delta, gamma, theta waves are getting changes on the brain system. That particular area we try to find out. The majorly, remember, according to my clinical experience, the epileptic fits are formed majorly on the temporal lobe, so that time it is advisable to use for the seizures. There is a area is there, seizures area, we need to target the temporal region. But when the patient having the frontal lobe, the waves get changes. The frontal lobe is causing the epilepsy, convulsions to the male, female, adult or the children. So that particular time, this point frontal lobe waves are different, then you recognize to apply the needle. This also good point to treat for the convulsions or the seizures. So convulsion, seizures, epilepsy is the different thing in normally, but the children who do get the seizures, convulsions, we say for the children. For the adults, we say as a epilepsy. People says fix problem. Fix, not a fix. FITS is fits. Fits problem will get. That's called as a epilepsy, grand mal epilepsy, and also there is another type is petit mal epilepsy. So that to be recognized by the EEG, where the waves get different, there it's advisable to find out and then apply the needle. That would be better. Now we are talking about the front of the head, 1 chun long, that means approximately 3 centimeter from the bladder 3 straight down along the meridian. So this is really important point. Now you understand the chinga minga san so mi chinga chu chai u chu chang kwang tong tian lo cho yu zen tian. So how many points? 10 points. UB1 to UB 10 points. In that the mi ching chu chai wu chu. So that for area, especially that is UB1, UB2 and then UB3. UB3 is not only the UB3, vicinity of the UB3. UB3 point, you just descend to the downwards direction. Descends to the UB3, where the point UB3, 0.5 chun, proximal means above to the anterior hairline, 0.5 chun lateral to the midline. The point to be known as a mi chung, UB3. UB3 say downwards direction you just apply nearly 1 inch below, that to be treatable. Even one patient, even every day I am treating for the last 5 days, one patient who got the who got the cardiac problem, it is the angiogram has been done. 70% is one vessel, 80% is one more vessel, and then 85 to 90% is one vessel. Triple vessel disease, the cardiac related problem he do have. There I just applied this particular point to treat for the cardiac related disorders in order to improve the coronary arteries shouldn't get much blockage. For that's the reason I just applied UB3 point downwards direction, one tune below. From here you just apply.
पर जो भी आपने ये लगाया है ऑलरेडी निडल, तो वो 3 चून हेयर लाइन से 3 चून ऊपर है क्या सर?
नहीं नहीं नहीं, एक्चुअली वो हेयर्स है ना, हेयर्स तो यहाँ से हैं, राइट. दिस इज नॉट द एंटीरियर हेयर लाइन. जहां से हेयर शुरू होता है ना, वो एरिया टू बी नोन एज ए एंटीरियर हेयर लाइन. यहाँ से आपको 4 फिंगर्स अबव, मतलब अभी आप देख सकते हैं 4 फिंगर्स अबव, तो फिर नीडल तो उधर ही है, 3 चून. तो ग्लैबेल्ला के नीचे यानी एंटीरियर हेयरलाइंस के नीचे मैंने लगाया हूँ. सो नाउ वी अंडरस्टैंड कि अभी कौन सा लगाया मैंने, या UB3 पॉइंट. यू नो UB, so many things you need to recognize. UB is treatable for the thorax cavity. UB3 treatable for the thorax cavity. UB belongs to the thigh yang meridian. Then the UB meridian is the thigh yang meridian, but thigh yang meridian is the deficiency. UB get deficiency, that causes the problem in the lungs related disorders as well. When you are treating to the urinary bladder meridian, thigh yang is treatable for the thigh yin. According to the midday and midnight law. Midday and midnight law, इसका मतलब you understand what is the organ clock theory of the UB meridian timings. 4 o'clock is the peak timing, evening. 4 p.m. is the evening time. What is the 4 a.m. in the morning time? Lungs problem. So when the UB get problem, the lungs also gets the problem, vice versa. Then you are treating to the UB meridian, that indirectly will be treatable for the what condition? Diaphragm, above the diaphragm, thorax cavity, chest cavity, then it is the lungs and then heart. Both can be treatable by activating the Mi Chung point. समझ में आता कि क्या? तो भी ಇಟ್ಸ್ ಗೋಯಿಂಗ್ ಒಳಗಡೆ ಹೋಗ್ತಾ ಆಯ್ತಾ ನಿಮ್ಗೆ ಯಾರ್ಕನ, ಅಥವಾ ಎವಾಪರೇಟ್ ಆಗ್ತಾ ಆಯ್ತಾ? ಜೋರಾಗಿ ಹೇಳಿ. ಇಲ್ಲ ಸರ್ ನನಗೆ 30% ಅರ್ಥ ಆಗೋದು, ನನಗೆ 50% ಅರ್ಥ ಆಗ್ತಾ ಆಯ್ತಾ, ನನಗೆ ಪೂರ್ತಿ ಸಂಪೂರ್ಣವಾಗಿ ಅರ್ಥ ಆಗುತ್ತೆ, ಬಟ್ ಯಾರಿಗೆ ಎಷ್ಟು ಅರ್ಥ ಆಗುತ್ತೆ? ನಿಜವಾಗ್ಲೂ ಜೋರಾಗಿ ಬೇಗ ಹೇಳ್ಬಿಡಿ. ಟೆಲ್ ಮೀ ದಟ್. ನನಗೆ ಯಾವುದು ಅರ್ಥ ಆಗೋದಿಲ್ಲ ಅಂದರೆ ತುಂಬ ಸಂತೋಷ ನನಗೆ. ರೈಟ್, ಯಾರಿಗೆ ಎಷ್ಟು ಅರ್ಥ ಆಗ್ತಾ ಅಂತ ಬೇಗ ಹೇಳಿ. ಅಂದ್ರೆ ಯಾರಿಗೂ ಏನೋ ಅರ್ಥ ಆಗ್ತಾ ಇಲ್ಲ ಅನ್ಸುತ್ತೆ. ಹೌದಾ? ನಿಜವಾಗ್ಲು कुछ भी समझ में नहीं आता आपको? Right. I am also getting and also get confusion. बंदा आज ही सीढ़ी में देख रहा हूँ पूरे साल में, ना इसको बोल रहे समझ में नहीं आता, इतने दिन क्या कर रहा था तुम? Now, so you all are my friends. I hit you, I hug you. Don't worry, I love you all, right? So hopefully now we will see that which one I told you, this UB3. UB3 is the one line that's called as a lateral line of the forehead. ये मैं नहीं बता रहा हूँ, who is telling? World Health Organization has been proven this can be applicable for that particular disorder. Now coming to the lateral line of the forehead, that to be known as the one tune long 3 centimeter from the stomach 8 straight downwards, that to be known as treatable for all the reproductive related disorders. Treatable for the reproductive related disorders. यहाँ पे एक लाइन मिस हो गई है, so I'll tell you, keep it in the mind. UB3 is completed. After the UB3, do you know there is the young boy? Yang Bai means gallbladder 14. You know Yu Yaw means extra 3 point. At the center of the eyebrow, you take upward direction. You go straight upward direction. But this area to be known as one chun distal to the downwards direction, that area to be known as a GB area, hepatocystic area. That means liver and gallbladder can be treatable by activating to the downwards direction, and then stomach area can be treatable 1 centimeter above the anterior hairline, superior level. You just apply this one half centimeter, that means 1 centimeter above, you just apply, that is stomach related problem. 1 centimeter below the hairline, you just apply, that to be treatable for the liver and gallbladder region. सर जल्दी प्रैक्टिकल शुरू करो सर, ये समझ में नहीं आ रहा है. Then come to the reproductive area, that area to be known as a weight, that means is stomach 8. Stomach 8, do you know 4.5 chun lateral, then further 1 chun below, from the stomach 8 downwards direction, that to be treatable for the pelvic geo and then the back geo. This related problem can be treatable, the pelvic related disorders, male and then female pelvic related problem, especially any kind of the pelvic disorders. You just, no matter whatever they do have any problem, the male having the problem, the semen related problem, spermatoria related, nocturnal emission related, or the premature ejaculation, or the erection related problem, impotency. Then female, we look into that frigidity, menstruation related disorders, infertility condition, pelvic related pain, leukorrhea related, dysmenorrhea, amenorrhea, or the menopause related condition, hot flushes conditions can be treatable by activating the reproductive area. The name itself to be known as a reproduction, that indicating to the male is the testicles, female for the ovaries, collectively to be known as a gonads related problem can be treatable by activating the stomach 8. So whenever I'll tell you, write down, then try to work out at home. See, normally in the theoretical class, I can give you all the information, but your duty to again open your book and thoroughly study. But this took me years together to keep it in the mind. It's not super simple to come directly in one class. Easily you can come. Day and night I'll dedicate for this, and definitely this fruitful is coming in front of you. Likewise, you also, maybe it's coming to your mind, but even I used to say to my children as well, but today when the lecturer or the teacher will give the class to you, then perhaps you will understand 50%. In that 50% you understand, further you come to home and then repeat the same, then you will get the up to 80%, you will recognize the subject. Once you completed 80%, then again you read, once again you will get 90%. Perhaps you do the dedication, you will get the 100%. Otherwise, no, easily anything may not become. The 12 different types of the scalp acupuncture, itna mujhe padhne ke liye, I have dedicated so much time to understand. Right? It's not super simple. But I mean to say, when I'll give the skeleton to you, you note down. Then you work out on it. But definitely this will be fruitful.